Hello and welcome to the pharmaphorum podcast. I'm your host, Editor-in-Chief Jonah Comstock. I'm joined today by Dr. Colin Banas, Chief Medical Officer at DrFirst. Colin, mind if I call you Colin?
Not at all. Go for it.
Colin and I are going to talk a little bit about a very hot button issue today in the world in general and specifically in the United States. Related to prescription drug pricing and affordability. Obviously, this is a huge issue right now, creating a lot of challenges for a lot of people and seeing a lot of attention from the government. But so let's start with that, Colin, to tell me a little bit about kind of the moment that we're in now from your perspective and sort of how we got there.
Oh, wow. What a loaded question. Affordability is definitely top of mind when it comes to prescription adherence, prescription decision-making at the point of patient care. How did we get here? I don't know if we have enough time to talk about how we got here, but it's certainly a long and convoluted journey into just how complicated the system has become in terms of prescription benefits, prescription pricing, and then really, I think this is what's more top of mind lately, is that we are now starting to have expectations at the provider level and also at the patient level of transparency to these things. Some of these are regulatory requirements. Some of these are just, common sense, good business. But the idea of being able to have better understanding at all levels of what a price is going to be, what it's going to take to get my patient on therapy and keep them on therapy. And so I hate the term consumerism when it comes to patient care, but I do think we are in an age of consumerism and heightened expectations as to what the patient care and patient experience is. And it's really, a full decade or so behind other things like aviation, banking, and shopping, but we're getting there. So that's a long-winded answer as to how we got here, but I do think consumerism and transparency have become top of mind.
Right. I mean, and that ties directly into the price issue, right? I mean, part of the problem here is that the market forces don't seem to be trending towards affordability for patients the way that you might imagine other more sort of consumer driven industries, that the price comes down to where supply meets demand, and instead we have these sort of out of control prices even when there's a healthy amount of demand and a reasonable amount of supply.
Yeah, healthcare is so tricky in that it's one of the few industries that really doesn't obey that intersection of supply and demand that you're alluding to. And in fact, on multiple levels, healthcare has what I would call supplier-induced demand. In other words, patient comes to me and I'm as a provider, I'm telling them what they need. Now, obviously, we're getting better at that in terms of, again, transparency, whether it's at the prescription level or even things at like procedures. There are new requirements on the docket that says, hey, hospitals, hey, providers, you need to be more upfront about what things cost, what out of pocket is for your patients. And so I do think we're inching our way there, but it's been a long time coming.
Yeah. So tell me a little bit about kind of your expertise in this and DrFirst and how you guys fit into this moment and these trends.
Yeah. So first and foremost, I am an internal medicine physician. So prior to joining DrFirst as the Chief Medical Officer, I was a practicing hospitalist and the CMIO for a large academic health system in the Mid-Atlantic. I was there for 17 years before joining DrFirst a little bit over 3 years ago to help with innovation and strategy. And to understand how DrFirst fits, you have to go back to the genesis of DrFirst, the company. And January 1st of the year 2000, DrFirst was founded as one of the very first e-prescribing companies this is before e-prescribing was really even a thing. This is way before meaningful use and the explosion of the adoption of EMRs and things like that. And from the roots in e-prescribing blossomed a lot of innovations around what I call the medication data space, the medication safety space. And what I mean by that is that we have innovative tools and solutions around things like medication reconciliation, controlled substance prescribing, and then, more recently, pioneers in what I call price transparency. So we were one of the first companies to show prescribers what a patient's copay was going to be at the point of making that prescribing decision, and then also show them alternatives that they could switch to directly within our software interface to say, now you can have these meaningful conversations with the patient in front of you about what they can expect with a copay. And then actually within the last 3 to 4 years, we've also flipped into a patient engagement space where we're actually revealing similar transparency related to prescription costs to the patient via SMS app-like experience. And with that, and I think we'll get into this in a second, but we're also able to deliver things like education, things like reminders, and probably most germane to this conversation, things like coupons and savings cards directly into either the prescribing flow or into the patient flow.
One of the big debates, I think, around drug pricing is this question of whose responsibility is it now to fix it, and who's in a position to make a change here, right? So obviously, lower prices would solve the problem, but some of the things you're describing, price transparency, education, giving patients the ability to make kind of the smartest choice from the self out of what is available. How important is that, and how much of a role does that need to play versus some of the bigger kind of policy solutions?
Yeah, so I think you're spot on, and astutely you're picking up on the solutions that I've been talking about. Really are absent those external government type forces or other regulatory influences that can influence drug pricing. What I'm talking about is absent those changes, which are in motion and have been for quite some time. What can we do at what I would call the ground level to empower our providers, empower our patients to have this data in front of them when they need it? And so what I'm really talking about, so if we go back to price transparency for the provider, so I have you in front of me as a patient, I'm making a prescribing decision, and it says, I pick one antibiotic, it says that one's not covered. If you want to go with it, it's going to be $100 out of pocket, but look, here's 3 others. Click here to make that change. The reason that works is because I've done it with real-time data. In other words, the way our software functions is we're doing a real-time false claim against your benefit. So if you hit your copay deductible earlier that morning, we're going to know about it. It's not an estimation. It's actually a false claim. So it's real data. And then more importantly, it's completely within workflow. And then the third thing is that it's actionable. So I can make the change, I can make the decision, I can have that conversation all within that time. Because if at any moment I had to deviate from my workflow, you're going to lose me as a potential user. Like if I have to jump into a different application, if I have to pull up a different reference website to look these things up, it's all going to fall apart because, the clinical visit is 15 minutes max, and there's so much that has to occur in that 15 minutes that every second, every click is precious. And so we've consciously designed solutions that maximize the experience, reduce the clicks and the keystroke burden.
So what are some of the kind of ways that this, things like transparency, education can actually, and coupons you mentioned, can actually reduce costs? Is it about connecting people to things like generics that are actually cheaper, or maximize their access to sort of discounts and deals that exist?
Yeah, all of the above, and that's what makes these solutions so powerful. So it's the ability to suggest generics when appropriate, when applicable. It's the ability to show you, yeah, you could go down the street to your local pharmacy and it'll be X amount of dollars, but if you want to do a mail order, it's going to be this. Or if you want to do 90 instead of 30 pills, it's gonna alter the, there's all of these various, factors that go into the cost. Um, and all, and I just keep coming back to this. It's all about making the provider and then by proxy the patient aware that these options are out there, because absent these solutions, I would assume that antibiotic I picked was perfectly. I had no idea. I would hit the send button and out the door you go, and I would never know if you didn't get it unless you showed back up in the ER 3 days later because you said, "Doc, I couldn't afford it." Whereas if I had you in front of me and I see it's $100, but this one over here is $5, and from a clinical perspective they're equivalent, I'm going to make that change right there, and I'm going to have a conversation with you about it. So it's all about making because it's a very complex system that we're talking about in terms of who's filling it, who's paying for it. It's very hard to wade through all of that, whereas the software can just cut through it and give you the insights. In terms of coupons, same idea, right? There's a lot of plans for the insured out there. There's a lot of high deductible plans. A lot of patients are opting to use cash, completely out of pocket to get their prescriptions because the copay hasn't kicked in, or the deductible hasn't been met, and it's easier, it's cheaper to do cash or to use one of these coupons. And so same idea. We're going to use our technology to match up you as the patient and your attributes in the script that went out the door to see if there's anything that we have access to that you're eligible for, and then we're going to serve it up on your smartphone.
And this is sort of win-win, obviously for the patients and for the providers. But what about the pharma companies? I mean, is this end up creating value for them?
It's very convoluted, and I'm in no means an expert in this space, but these coupon programs exist for a reason. Like that, there is money being made all around the pie, if you will. And so I think at the end of the day, if we take a step back of, as a nation and say what's best for the nation, independent of all of these individual players, it's getting patients on and keeping them on therapy. Because we actually, I have the benefit of leading our applied clinical research arm for the company. We have some pretty robust real world data that shows patients who engage with our solutions, whether it's the education, the reminders, or the copay assist, they're more likely to get their medications. They're more likely to stay on their medications. And more importantly, they're less likely to be readmitted. And that's statistically significant in a number of our hospitals. So that's the fun stuff about my job is real world data and real world impact of these solutions.
Awesome. So you mentioned we've been talking mostly about the situation in the United States, but I mean, is this a global problem too? Is that something you guys are focused on at all?
DrFirst main footprint is United States. We do have a little bit of a presence in Canada, but absent that, nothing in Europe or overseas per se. So it's really hard to comment. I will say from my reading, some of the other nations who have adopted more of a socialized medicine definitely different experience when it comes to prescription affordability. Well, we could leave it at that.
So I think we've touched on this, but I want to talk about this idea of cost-related non-adherence, right? So we're at a point where costs are actually keeping people from doing what their doctors are saying and taking the steps that would keep them healthy. I know certainly we've heard a lot about that with insulin and people rationing insulin because of the costs. How does that kind of well, for one thing, first of all, I guess tell me a little bit about that trend, but also then how do you tailor your approach to think about that and to really try to reverse the trend there?
Yeah, bend the curve, if you will. So it's interesting and it's a very timely question. We actually conduct surveys on a number on a frequent interval at DrFirst. We just did a survey of over 200 adults related to medication adherence and trends and patterns in that space. And you're spot on. Our data showed, and I think this echoes other similar type surveys. 50% of the patients surveyed admitted to not picking up a prescription due to copay, due to cost. 25% of them admitted to not refilling or sort of stopping a therapy without telling the doctor, again due to cost. And then this is the one that's really most germane to your question. 14% of them said, I have rationed my medications based on cost. And so that becomes difficult to tease out unless you're looking at the data and have some pretty robust analytics. But that's as a clinician, that's sad. That makes me sad because obviously the goal is to get and keep patients on therapy. And the fact that patients are having to make these very difficult, sort of life and death decisions, between, daily living and affording their medications is one of the things that drives, what I do with the company in terms of solutions that can help make that impact. So, I'm bringing it back full circle into what are the things that we can bring to bear for the patients and the providers. And then more importantly, how can I prove it, or how can we as a company prove that we're making that impact? And like I said before, that's the fun stuff.
And it seems like what you're doing, I mean, we talked earlier about how there are, this is sort of in lieu or in stopgap of the big systemic solutions. But a product like DrFirst, an offering like DrFirst has, is valuable even in a world where the drug prices are kind of more reasonable generally, right? Just in as an optimization play.
I think 100%. Absent, let's pretend that cost really wasn't an overriding decision factor. You can think of some of the things our solutions are doing as a form of decision support or CDS. You'll hear that a lot in the informatics realm, and so the ability to offer alternatives, the ability to show provider and patients potential interactions, potential side effects, et cetera. It's all a form of decision support. It's all affecting and improving the clinical experience for both the provider and for the patient. And so I absolutely agree, absent the copay assist or the price transparency, I absolutely agree there's inherent value in all of the solutions that we bring to bear.
So, anything we haven't discussed yet that you think is an important angle on this, or anything you want to talk about?
Well, I think I've definitely spent a lot of time talking about the provider side of it. I do think back to my original comment about consumerism. I do think we're in a very exciting time of patient empowerment and patient engagement with some of these data and some of the solutions. And so the trick, and we work very hard on this at DrFirst, the trick is to meet the patient where they want to be met digitally. And so that's why we have solutions that are text-based or SMS-based that will deliver an app-like experience, but we're not going to make you go get an app or do a lengthy registration or log into an additional portal. Because we know patients, by and large, over 90%, they're going to look at SMS messages. They're going to interact with SMS messages. You probably, when's the last time you actually ignored one? So I think that's just a nice way of saying, the patient's turn of running the train is on its way. We're finding that more and more we have to meet the patients where they want to be met, or they're gonna vote with their feet. They're gonna go find a different solution or a different provider. And so I do think it's an exciting time on patient side in the age of consumerism, even though I hate that term. So
yeah, it's such a tricky thing because we talk a lot about patients, taking control, taking the reign of their own health. The fact that, we're creating a lot of technology that makes that easier to do. But, the patient is still, when I go into, the doctor, I'm not excited about it. I'm not saying today I'm going to grab the reins of my health. I'm like, I got to go to the doctor. And a lot of what really motivating and engaging patient comes down to is meeting them in that moment and saying, like, making it easy for them to do, to make choices that are beneficial for them.
It's exactly so. The term I always use is removing the friction, whether it's removing the friction for the doctor or the nurse or the patient. So what's going to make you more likely to stay engaged? I just made it incredibly easy for you to do the right thing. Access your schedule here, make a change here, communicate with the doctor this way, request a renewal, refill, etc. And so that's the trick, is making that as seamless and as frictionless as possible in order to ultimately improve the experience, but also retain that patient within your organization.
Yeah. I think it's interesting to talk about patient, empowerment in this context of drug prices, because the situation patients find themselves in when they're prescribed a drug and they can't afford it is so kind of disempowering. To be told, this is what you have, this is the treatment for it, and it's out of reach.
It's disheartening. And the other thing is that a lot of time, let's pretend for a second that you could eventually get back in touch with your provider and make a change that was affordable. You've still introduced all sorts of friction and delay into the process, because you didn't know until you got there that it was $100 out of pocket. Whereas if I could have known that when I was making the decision, or whether you could have seen that because we gave it to you, on an SMS app-like experience, we can shorten the delay and we can improve the communication, that sacred connection between patient and provider. That's the closed loop, system that we're really trying to create, is get it in front of the right people at the right time so we can reduce delay and get them on therapy.
Awesome. Well, thank you so much, Colin. This has been a great conversation. Really interesting, important work that you're doing to tackle, at least on some level, a really huge problem.
Yeah, I appreciate you having me. Thank you so much.
Absolutely. And good luck with everything that you're doing, and hopefully, this is a problem that'll be sort of tackled from multiple angles at once, right?
Yeah, let's hope so.
All right. Thank you so much. Thank you all for listening. That concludes this episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about other installments in the series, at pharmaphorum.com/podcast. The pharmaphorum podcast is also available on iTunes, Spotify, Acast, Stitcher, and Podme, where you can find and subscribe by searching for pharmaphorum. And don't forget to visit our website, where you can sign up for daily news and analysis bulletins, and to follow us on Twitter at pharmaphorum. Thanks for listening.